Next, under the category why do we fall ill from this chapter, there are two important areas we have to study. One is treatment and another one is prevention. The term is very clear and simple. For example, we all humans are prone to disease. That means we all will get some type of disease. It can be viral, it can be fungus, bacteria. So it will go. It can we will get diseases when we are moving from one place to another, or when climatic changes, weather changes. Sometimes food. Sometimes when we come to some areas, some room, etc. Many ways we will get disease. That means we will not be healthy according to the terms of WHO. So what is happening is getting a fever is different and getting a jaundice is different. Fever, what is the case of the fever is the fever will come normal fever, which is caused by the rhinovirus. Normal fever which is come to us, it will be there for 6 to 7 days, a week, for a week or two. Then it will normally it will get cured. But when we are coming to the hepatitis or jaundice, what the problem is, when we get these disease, conformly the person will die. This person will die. So it is very difficult. That means we are losing a human life, and this jaundice is spreading. Best example for this is coronavirus, which is running at this time. Why people are saying that we need vaccine against this virus? Why? Because normally whenever a viral infection comes to a body, for example chickenpox is also caused by a class of virus known as varicella zoster. That is a biological name given to that virus. So when we get chickenpox, once a chickenpox comes to us, it will cause body pain, we'll get boils, etc., and it will go after 20 days or 20 after 21 days. Okay, leave it 1 month. After 1 month that particular person will cure. Once it is cured, we will get immune. Hardly less than 1 percentage of the people will get chickenpox again. But some viruses are not like that. For example, coronavirus. When we think about this coronavirus, and the same thing like HIV AIDS also. HIV AIDS, coronavirus, and some protozoans are also causing disease. For example, malaria. So what is coming making a main issue why the people are saying that we need vaccine or we need something to be there before it infects us? Because once it is infected, the guarantee of survival is very very rare. For example, you take the condition of jaundice. Once a jaundice get infected, this jaundice organism is killing the liver, human liver. Once the human liver is damaged, then full body physiology will be disturbed. So that will cause a death, a sudden death, or some chronic type of ill effects to our body. So in order to avoid that, we need disease, we need vaccines, etc. So b- for a particular disease there are two phases are there. For example, two phases are there. One is known as the prevention. That means getting prevented before we are getting that particular disease. After sometimes we have not prevented from that, we got disease, then comes the treatment. It depends upon the intensity of the disease. For a common flu or a fever, we don't want any medicines, sorry, we don't want any vaccine. So everybody knows that once it has come, it will be there for 4 5 or 7 days or 2 weeks. Okay, 7 after 7 days again, that is not just that our system is not cooperating. if you take some antibiotic, that antibiotic is the treatment for that particular disease, then it will cure from the body. But serious diseases, we have to prevent it before the infection. Coronavirus is the best example. Coronavirus is causing mass infection plus death, but conditions will change from area to area, person to person. So these are the two main principle in disease. Either we have to prevent the disease before coming or before hitting, or protect from the particular disease. Am I clear? So there are two principles are there. First principle is the principle of treatment and the principle of prevention. Treatment will be given after particular disease, after a particular disease. So in this particular disease, according to the part of the treatments, there are a lot of things are available. For example, medicines will be given, and they will be asked to take a good food which is rich in vitamins and minerals. Or sometimes they may be saying that you take only some, don't take much solid food, take food in liquid form, that is lukewarm food like porridge, etc. In some conditions, in some conditions, whenever we are getting some stomach problems, they will ask to take some probiotics. Probiotics means, it means curd or something. You take it so that the microorganism that is present inside the curd, that is lactic bacillus, that also will helps in digestion. So that will do the digestion part. And whenever you are doing taking this treatment, try to avoid this, try to avoid that. So these are the parts of treatment. And whenever this treatment is coming, when the treatment is given according to the organism, that means one particular antibiotic may be not helpful for treat all the diseases, all the diseases. For example, I will give you one best example. Whenever a dog bites, so there is a chance that whenever these dog humans, sometimes humans are not coming in a very rare scenario cases to spread of rabies, then bat, etc. When they bite us, normally we will say that you have to go and take anti-rabies injections, which is a part of the treatment. Okay, for example, you think like that. A place is there, maybe a nearest hospital or a foot-fetched hospital is around 20 kilometers away or 15 kilometers away. So what they will do? So in that condition, doctors are doing one thing. They will give TT. There's one injection is there, tetanus injection is there, known as TT. So this TT will be given. Then they will say that within particular time, because TT is having some time limits, it can prevent, thus if rabies is there, it can stop the prevention for 2 to 3 hours. Within this 2 to 3 hours, you have to go to that particular hospital and get the anti-rabies injection. So according to the organism, different steps we have taken. So one of such thing is known as the antibiotics. Antibiotics mainly comes in the form of injections and in the form of tablets. And anti means against, biotics means against life. That means which is fighting against this bacteria, generally classified as antibiotics. So these antibiotics are also given according to the treatment. That means if they find out that this particular person is infected with the best example, yeah, high fever, high fever. So most of the doctors will recommend amoxicillin. So it can kill a broad spectrum of antibiotics that is causing infection, that is causing this uh, fever. But whenever we are getting tonsils over here, tonsils also can cause to some infection. That time they will give azithromycin tablets like azithromycin, etc. So each and every organism they have given different types of antibiotic. All the antibiotics will never effectively work in all the conditions. One of the best example is penicillin. Penicillin was the first antibiotic that was discovered by Alexander Fleming. And when this antibiotic was discovered, this antibiotic was used for everybody. So in that time when this antibiotic was discovered, that time it gave immunity, that means a resistance to all the people that is in and around that particular area. But after sometimes they have found that this penicillin is not finding some effects in some persons. Some persons are trying to get allergic, so they have to find out another source. So these changes will takes place from person to person, and the treatment will vary from disease to disease. For example, burning is also considered as a disease. That means burning means physiology, physically you are not well. So according to the WHO, it is considered as a disease. For the treatment of burning is different. The treatment for fever is different. Treatment for cancer is different. Treatment for stomach pain is different. Treatment for kidney is different. Treatment for heart is different. So each and everywhere this will be keep on changing. So this you have to keep in mind. This is the major thing that is coming under the principle of treatment. And next one is prevention. Prevention means before getting this disease, prevent it. So there, it is a 90 percentage of the prevention is in the human hands. That means cleanliness, any type of cleanliness. Hand wash is the basic cleanliness. Hand wash, then washing the cloth properly, around the surroundings. If there is any type of infections around you, remove factors that is responsible to cause that infection. These are the main things, but that is everything. It depends upon even after all this doing, if you got infection, there's a chance. So there the science has developed a system known as vaccination, otherwise known as immunization. Vaccination is a part of immunization. Immunization means getting resistance. So vaccination is a part of immunization, and vaccination was first, the father of vaccinology or father of vaccine is Edward Jenner. Since Edward Jenner is the first person to make vaccine against smallpox and given to the society. So they boosted the immunity and the smallpox was prevented. And smallpox is the first disease that was eradicated from the face of the earth. Thanks to Edward Jenner, who found out the solution for that. He was not a doctor also. It was a normal. Same way for the mosquitoes. In the rainy time, the malaria, dengue, those type of diseases are possible to come. So how to prevent this? Keep our surroundings clean. There should not be any stagnant waters. There should not be any source for the malarias, and cooler and everything should be left of dried. So nowadays we can know that from the municipalities and the panchayats, people are coming from in door to door and checking there is the source for the mosquitoes to grow. And it is one of the major diseases that through mosquito as a vector, major disease that is taking place in developing countries like India, Africa. So lot of malaria is a common disease. India is so far better when we compare it to Africa. Once you go to Africa, if you don't get malaria, then we can't survive there. That much of mosquitoes and contaminations are there. So like this, these are the main methods to prevent from any type of diseases. So if you want to prevent from fire, you have to away from fire. If you want to prevent from an acid fall, you have to take its precautionary measures. So like that, for each and everything, these precautionary measures will be keep on changing. So this is a main principle behind this. So I request everybody to read this and understand this, what is the principle with this, and any doubts, please let me know. I will help you out. Thank you.